All right, I'm going to go ahead and get started. I'm Leslie Montgomery. I'm one of the veterinarians here at Desert Pines Equine. And tonight I was going to have a talk about osteoarthritis. And I'd like to keep it pretty, not formal, but just relaxed. And if you guys have questions along the way, if there's something you don't understand or doesn't make sense, just go ahead and interrupt me, and I'll also have time at the end for questions. So just ask away. It's meant to be informative so you guys can get what you came for out of the talk. So I'll just start by introducing myself and just get a little bit of my background and kind of how I ended up here. So I graduated from Iowa State in 2007. That's where I went to vet school. And I learned a lot about pigs and a little bit about horses. And then after that, I did an equine internship at Wilhite and Freeze Equine Hospital, which is in Kansas City, Missouri. And it was a nice internship. It was a very general practice, so I saw a lot of just common things, but we also had internal medicine cases that were more referral type things that are more complicated. And then we also had a surgeon, so I got to be exposed to surgery and found that I really liked it. So after I completed this year-long internship, I went to Manor Equine Hospital, which is in the other side of the country in Maryland. And it was very different out there, which I'm really glad I got the chance to be exposed to that. So it was mainly a surgical internship. We did about 4 surgeries a day, mainly worked on standard bred racehorses. So a lot of OCD, which is a disease that horses are born with in their bones. So a lot of scopes where you put the scope in the joint and see what's going on. So that was a really neat experience. And then from there, I was very fortunate to get a surgery residency at the University of Tennessee, and moved down there and spent 3 years in the South, which I really enjoyed, surprisingly. I thought it would be not to my liking, but it was very, very nice down there. During my time there, I was trained to do all different kinds of surgery by 4 board-certified surgeons. And we also learned all the newest diagnostics and treatments and everything with lameness, and also rehabilitation. So this is in the new hospital. They have an underwater treadmill and kind of the new things coming out. So it was a very good experience. I also was lucky. It was only about 2.5 hours, 3 hours from Lexington. So we had a hospital that worked with us, and we went up there and spent about 3 months per year in Lexington at Woodford Equine Hospital. It's about the 3rd largest hospital in Lexington. So we got to do a lot of racehorse surgery and internal medicine and things like that. So just a wide gamut of different types of horses and stuff. So then from there, I was fortunate enough to come here to Desert Pines. They were crazy enough to hire me. And if I can get, hang on one second. I don't think my click's gonna work here. No. I might have to come over here. I don't know if anyone knows how to get it to, when I click, you know, it's supposed to come up. Anybody? Dr. Lamb? These are supposed to come up with each click, so I'm just gonna have to leave them open over there, but that's fine. So anyway, so then I came here to Desert Pines, and they were fortunate enough to give me 2 months off to study the surgery residency, the 3 years of doing surgeries and all the education associated with that qualified me to take the board exam to become a board certified surgeon. And so they gave me the time off, and fortunately, I'm not sure how, but I managed to pass the test, and then became a diplomate of the American College of Veterinary Surgeons. So if you see the extra DACVS after my name, that's what it is. It just means I've spent the 3 years doing the surgery residency and taking the test to make sure I actually learned something. So, and then I came here 2012, I think it was August, and been here ever since. So happy to be here. All right, so I also have a video for you guys, if it will play. If not, it's not catastrophic. Okay, I lost it again. All right. So this is a little music video. Obviously it's done by Adequan, which is one of the joint supplement companies, but I think it does a nice job of just kind of going over arthritis in general, and just good introduction. So we'll go ahead and play that, if it will play.
Wear and tear of daily use, errors in the way we shoot, trips and missteps, jarring pores. These are things that hurt a horse. Balance joints get out of whack. Now the horse is holding back, hesitating, acting lame. Swollen joints show signs of pain. Oh, stop, block, and stimulate. Now the horse is doing great. 7 treatments and you're on. Thank you, Adequan. For every stud, gelding, and mare, there's a cycle of wear and repair. It has a most important point: a healthy, balanced equine joint. Cells are working hard to make cartilage regenerate in the course of every day. Synovial fluid gets replaced. Stop, block, and stimulate. Now the horses are doing great. 7 treatments and you're on. Thank you, Adequan. When this cycle gets disrupted, then the joint becomes corrupted. Watch for signs in hocks and knees of degenerated joint disease. You can spot the early stage. Look for swelling and mild pain. Yes, these are the classic signs of attack by destructive enzymes. Stop, block, and stimulate. Now the horses are doing great. 7 treatments and you're on. Thank you, Adequan.
How to make this go away?
First we ask the FDA.
Are there products you've approved and found them safe to be used?
The FDA can guarantee a medication's potency. To study its effectiveness, approval needs its faster test. So stop, block, and stimulate. Now the horses are doing great. 7 treatments and you're on. Thank you, Adequan.
The best drug to treat DJD modifies this joint disease. The FDA says only one has their approval. Adequan.
Once Adequan treatments are in place, the cycle of destruction breaks. Healthy joints can soon return. This is all you need to learn. So stop, block, and stimulate. Now the horses are doing great. 7 treatments and you're on. Thank you, Adequan.
Okay, so definition of osteoarthritis is degeneration of joint cartilage and the underlying bone causing pain and stiffness. So the way I wanted to go through this talk and just kind of break it down was start by going over the anatomy of the joint. What's in a joint? What are the pieces that are related when we're talking about arthritis? How does it occur? What does it cause in the horse? And treatment options, and of course prevention. All right, so first is an image. I hope you guys can see it. Basically we have, this is a fetlock joint or an ankle, cannon bone and P1, which is the first phalanx here. The joint, which is obviously the junction of the 2 bones, is surrounded by a fibrous joint capsule. And that's what keeps all the synovial fluid inside the joint. And the joint is bathed by the synovial fluid. It keeps the cartilage healthy and provides all the nutrition to it. So it's very important. The other parts, the blue here is the articular cartilage, so that of course is at the end of the bones, so it provides a nice surface for the bones to move across each other. The subchondral bone, which is the bone underneath the cartilage, and that's important because it is directly underneath the cartilage, so if it has a problem, it can change the shape and health of the articular cartilage. And then the final thing is the synovial membrane, which we have a blown up picture of here. And it's basically the lining inside the joint capsule. And it has the synoviocytes, which are these cells here, and those secrete the joint fluid, which keeps the joint healthy. So this is just the cartilage, the fluid, the synovial lining with the synoviocytes, and just a blood vessel. All right, the next image is a blown up image of what cartilage looks like. So there's a bunch of stuff in here, and the chemists are the ones to be left to deal with it, but there's some important parts that are in a lot of the joint supplements and things that you'll use in your horse. So I'll just go over some of those. Collagen is one of the most important components. It's these big tubules here. Hyaluronic acid, which you guys have probably heard of in some form or another. Chondroitin, which is a common joint supplement. Also can be called glycosaminoglycan. And then aggregans molecules. All right, so how does arthritis occur? And this is, I just wrote a process that's initially invisible that eventually leads to changes on x-rays. And I think this is an important point because a lot of times all of us think of arthritis as like a joint that has huge bone spurs and all sorts of problems on the x-ray. But the truth is that arthritis starts at a very small molecular level, and the soft tissues are the ones that first become inflamed. The lining of the joint capsule, all of the tissues inside the joint, the fluid itself. So you can have a horse with arthritis that does not have changes on x-rays. So it makes our job more challenging. But eventually you will see changes on x-ray. So just to bring home this point, does this horse here on your guys' left have arthritis? He may. You know, it's hard to tell, but the joint looks normal. Whereas this horse, obviously we have a narrow joint space, a ton of new bone. It's pretty easy to say there's something going on there. But they can look like this, so it can be a little bit difficult.
Is there any way to detect it at that stage?
Yes, there is, and that's a lameness exam is the biggest thing, and then we do joint blocks, and where we'll put actual lidocaine type drugs in the joint and numb the joint, and then if they go off sound and they're better, then we know. You know, that's the main thing, is by doing it that way. We don't have a great imaging modality besides arthroscopy, where we put a camera in the joint in surgery, and even then you have to have pretty decent changes to tell. Or, of course, in the studies they do post-mortem where they, look at everything under a microscope. But
Are there any chemical indicators?
There's not anything real great. There are ones that in research that they use. They look for inflammatory mediators and things like that, but nothing that we use in practice on a regular basis. But for research there are, yes. So we don't have a great indicator. Okay, so then I broke down how does arthritis occur into 4 different causes. So loss of joint stability, joint incongruency, meaning that the normal joint surface has been changed for whatever reason. And then trauma, of course, and aging, as many of us know. At least I feel like. I know I'm not that old. So the first one, loss of stability. This can be a problem with soft tissues, so tendons or ligament tears. So tendons connect muscle to bone, and ligaments connect bone to bone. And so any sort of disruption in these, because tendons and ligaments are very important for keeping the joints aligned and the bones where they should. So if you lose one of those ligaments and the joint can move as it wants, we can induce arthritis. Fracture, this is a condylar fracture in a cannon bone, so obviously through here, and now we have a piece of bone in the joint that is no longer connected with the rest of the bone, and that of course is going to cause a lot of instability in that joint and lead to arthritis. Okay, the next one is joint incongruencies, so fracture, like the last image, and then developmental defects, OCD, which is just a developmental problem with the cartilage and bone formation in the joint, subchondral bone cysts, which are cysts that form from a little hole in the articular surface of the cartilage and cause a big cyst. OC fragments, that's basically like a bone chip that's floating in the joint. And I got some pictures of those. Okay, so fracture, here the same picture again on the left, and then this is the most common place for an OCD fragment to form, which is the distal intermediate ridge of the tibia, which is in the hock joint. It just looks like this little fragment floating there, and then you have to kind of put on your imaginator, but this is the femur, it's just the bone, one of the bones that forms the stifle. Tibia is the other one, and here this is the medial femoral condyle, so we have just a blackening here, and it's just a cyst that forms and can cause arthritis. All right, the next cause is, of course, trauma, and that can be soft tissue. Some of the ligaments are very closely associated with the joint, and when you do a scope on the joint and actually look inside of it, sometimes you can see the ligaments. So we know that they're very closely associated, so a tear in that ligament can cause arthritis in the joint. And then, of course, instability from tears. Cartilage damage, of course, that's a big problem. So that can either be acute, meaning the horse hyperextended and broke off a piece of cartilage, or it can be just chronic, which is repetitive trauma. And I highlighted it because that's what happens most of the time. So many horses have a job that they do, and they do it over and over and over. So just repetitive damage eventually is going to lead to cartilage damage and arthritis. Okay. And then aging, so just use over the years, synovitis, which is inflammation of the lining of the joint, and capsulitis, inflammation of the capsule. All of those things occur just with age and use, as much as we'd like to reverse it. So this is just a big scheme of everything. So we have our 4 causes. And what those do is cause injuries to the cells in the cartilage as well as the lining. And when those cells are injured, they secrete enzymes, which are proteins that break down things, whatever they come in contact with. So they end up breaking down the cartilage and causing it to die and destroy it. And then that just creates a whole new cycle of inflammation. It's just kind of a cycle over and over. So it ends up down here at the bottom that we're breaking down articular cartilage. All right, so what does it cause? This is what everybody sees. Inflammation, decreased range of motion, joint damage, and pain. And what you guys see and what we see is a lame horse and a loss of performance. So a horse isn't able to do what he used to be able to do. Okay. Okay, so treatment, most of the treatment drugs are broken down into 2 categories, and I thought it'd be helpful to do that as well. Symptom modifying, so those are ones that treat the symptoms. They treat pain and they treat swelling, but they don't change the course of the disease. They're not going to make the arthritis stop. Disease modifying, these are the ideal drugs. These are the ones that are going to make the arthritis stop or at least slow it down. And these are kind of ideal. We don't have any perfect method, but this is what we're aiming for. Okay, we'll start with the symptom modifying treatments that probably most of you guys are very familiar with. Bute is the old standby. It's an anti-inflammatory, and it works by inhibiting the inflammatory cascade that happens. It also blocks the good things that the enzyme that it works on does, which is protecting the stomach and the kidneys. So we do deal with issues related to that. The new one that we have is, it's another category of drugs, is Equiox, and that is a COX-2 specific drug. So it only blocks the inflammatory actions of that enzyme, but it does not block the protective one. So it protects the stomach and the kidney. So that's what makes it different. Steroids. So I'm sure many of you have had a horse that's had a joint injected with steroids, or maybe yourself with just cortisone shot. So this is a very old standby. It's used a lot. It works very well in horses, but it does not, this is just a symptomatic treatment, so it's not going to alter the course of the disease. The disease is going to continue moving forward, and a lot of the steroids can be pretty hard on cartilage. So it's not something we want to jump to without, needing to. One of the newer treatments is Surpass. It's like Bute, but it's topical, so it's a cream, and you rub it in on the joint that's affected, and it gets absorbed into that joint. And the nice thing about that is it's localized, so you're not giving a whole systemic dose to the horse, so it's much more protective on the kidneys and the stomach. So those are the main symptom modifying treatments. So on to the disease modifying treatments. So these are the ones that we're hoping will either slow the progression of the disease, help reverse it ideally, and potentially even stop it. So nutraceuticals, I'm sure many of you have gone and wanting to buy a joint supplement either for yourself or your horse or dogs, and it's just overwhelming. There's so many options, and it's really hard to know which one to get. I don't have great answers on every single product, but I have a few guidelines that can help you choose one. There's a few that have been studied in actual clinical studies that were controlled and done correctly. So I'm going to talk about those ones. Cosequin ASU is one of them. And in the study they found that it does support cartilage health, just meaning when they induced arthritis in horses, it protected the cartilage compared to the horse having nothing. So it had less damage after having this. So it does protect the cartilage. The Platinum Performance CJ is another one that's been studied. And that one also supported cartilage health, and it was found to be an anti-inflammatory. It also has a lot of vitamins and minerals in it, which is nice, a little extra.
I've used that one with my horse. He's over 30.
Uh-huh.
And he has greatly improved, and I saw improvement within a week.
Oh, which one was it?
The Platinum CJ.
Platinum, okay.
And part of that, I actually thought about putting him down because he could barely walk.
Yeah.
So bad, and that has really helped him.
That's great. Yeah, and I hear lots of very good things about that product. It's a good one. I think I tried to pick ones that I think would be, have proof behind them. When you're choosing a nutraceutical, a few things to keep in mind. You want to pick a trusted brand. Now, what's a trusted brand? I mean, that's hard too. And the reason why this is such a big deal, there was a study that was undertaken, and they looked at what was actually in the jar compared to what is on the label, and most of the time it didn't match up. So, I mean, you're spending a ton of money, and they're not, even the amount that's in there, it's not actually in there. So they're not very controlled. It's not going through anything, these people can just make it. So it's kind of a bad deal. What Dr. Schur recommended, and I think it's a really good idea, is that you should never buy something that does not have a lot number or an expiration date. So, something to trace it back. So if there is a problem, then the company cares and they want to know what happened, and also that it's only good for a certain period of time. So those are some good guidelines. The other thing to keep in mind, and I don't know how important it is, but a lot of these studies that showed efficacy with these different nutraceuticals used 3 to 10 times the amount that they recommend on the bottle. So we don't really know if what they recommend works as well, because they gave a higher dose. But like you say, I've had many people tell me, you know, the platinum works and Cosequin ASU, and so that's where, you know, there's a little bit, we're still working on getting really controlled studies. So it's a big area that we need more information. Okay. All right, the next drug I'll talk about is Adequan, which was our jingle that didn't work, but it's polysulfated glycosaminoglycans, which is just a constituent of cartilage. And it also works to protect cartilage. The good thing about Adequan, there's a couple things that I like about it. It has been studied and shown to protect cartilage and also to be an anti-inflammatory. The tests that were done were using it as the label suggests. So it's not more or less or whatever, and it's not a different route. It was given in the muscle and it was shown to be efficacious. So we know, as they recommend it, that it does work. The other thing that I like about it, depending on your horse, if they hate needles, it's probably not for your horse, but we know they're not spilling it all over the ground because it's an injection that they get in the muscle. So we know your money's going into the horse. So that's kind of another nice thing about it. It can be given in the joint, but typically we just give it in the muscle. It can decrease the immune system in the joint and predispose to infection, so we try not to do it if we don't need to directly in the joint. We just give it in the muscle. Another new drug along the same lines is pinasan. Pinasan is a semi-synthetic polysaccharide. It comes from beechwood, and it has been studied as well, and it was the same thing where it was given the way that it's suggested on the label. The study showed reduced cartilage damage compared to controls. It also stimulated cartilage repair, and it's one of the few that's done that. So it has very impressive studies behind it. Unfortunately, it's not licensed in the United States, so it's not FDA approved. We still have it, but you know, take a little bit of a risk because it hasn't been studied in the US. They recommend intramuscular administration, so another shot in the muscle. You can give it in the joint, but that's only if needed. So that's pinasan. All right, hyaluronic acid. This one's probably more common for most people. Hyaluronic acid it's in the cartilage. It's also in the joint fluid. So it is all over the body in different places. So it's a very strong anti-inflammatory, and when you give hyaluronic acid into a joint, it stimulates the synoviocytes, which are the cells, to secrete their own hyaluronic acid. It can be given orally. Platinum CJ has it. There's other companies that make it. You can also give it in the vein with Legend, and we give it in the joint as well. So, yes.
Like, say Platinum CJ has it. It's in Platinum CJ?
Yes.
Okay.
Yeah, it's one of the ingredients. Yep. They have lots of things in there, but that's one of them, yeah. All right. We'll go on to this one's probably lesser known to most people. It's polyglycan, and it's made with 3 active ingredients: hyaluronic acid again, chondroitin, and N-acetyl D-glucosamine. There's one study on this that showed short-term improvement in horses in their lameness. It reduced bone proliferation, like changes that we see on x-rays, and it also was found to protect the cartilage. This one, the reason why it's not used that often is what it's labeled for is when a horse has a scope done on the joint, we have to flush the whole joint out. So you end up with no fluid after you're done with the surgery. So polyglycan was made to inject into the joint after surgery to replace the fluid. But a lot of people use it for other reasons. It can be given IV, but it's not labeled that way. But you may hear about somebody doing that. So. All right, IRAP. This one's pretty exciting, and I hope has anybody heard about IRAP? Yeah? Okay, yeah. We're using it here at our clinic. It's interleukin-1 receptor antagonist protein. So all interleukin-1 is one of the chemicals that's released by the cells in the joint to cause inflammation. So it's one of the major ones that does that. So what IRAP does is block that protein. And it's natural, it comes from the horse itself. We get horse's blood, and by going through a process that I can't explain, they can isolate IRAP out of the blood, and then we're injecting it back into the horse in a concentrated form. So all it really does is stop that protein from causing inflammation. And it's nice because it is the horse's own blood. It's not something from the outside, you know, so it's much safer. We tend to use this currently in joints that have become non-responsive to steroids. So, you know, really arthritic joints, not seeing any sort of response with the normal treatments. Also soft tissue injuries, so if a horse we think has a torn ligament, a collateral ligament or something like that, that ligament is in close contact with the joint, so by injecting it in the joint we can treat the ligament. One study is done on this, I think several. It has been shown to reduce lameness, which is unique. Also joint inflammation, so clinical signs that we're seeing are improving. And I don't know about you guys in the back of the room, but I think eventually we'll probably go to IRAP before we do steroids. I think that would be a better way. It is relatively expensive and kind of new, so it's in the works.
How often would you inject?
Usually 3 treatments every 2 weeks. So we would collect, and then we'd have enough to treat, and then just depending on how they respond, we have more. So depending on how long it lasts, we freeze it, and then we can use it again. So
that would be for treating an injury as opposed to injecting the joints prior to performance?
yeah, it would be, well, it would be for treating arthritis. So if you have I mean, that's why we inject joints or horses that have arthritis. We treat with a steroid to decrease inflammation. And this does the same thing, but the problem with steroids is it breaks down the cartilage, and the IRAP hasn't done that. So you can keep injecting and treating that joint without making it worse. And that's the problem. Anytime you do steroid injections, you know you're making the arthritis worse overall eventually. It's kind of just putting a Band-Aid on it. So, stem cells, I'm sure everybody has heard of. These are new in equine practice. A lot of work is being done. We did a ton of work in Tennessee on this, but it's just in the beginning stages of being published, so we don't have a lot of published information. But what stem cells are basically are cells that can become any kind of cell in the body. So you can make it into a tendon cell, you can make it into a bone cell, a cartilage cell, anything like that. So that's why they have so much promise. The different ways that you can get it are autogenous, which means the stem cells come from the horse that you're going to inject them into, so it's the same horse. Or you can use allogenic, which you get the stem cells from one horse and inject it into another one. The stem cell in a joint, if there's a soft tissue injury, so like a meniscal tear or a tendon or a ligament in the joint, or closely associated with the joint, that's what we're seeing the improvement in, not just general arthritis. So you wouldn't jump to stem cells because your horse has arthritis. All right, PRP, platelet-rich plasma. This, why we use platelet-rich plasma, platelets have growth factors which stimulate healing, and it's traditionally been used in tendons and ligaments, but there has been a lot of research in humans using it in joints that's promising. We don't have any studies in horses, but it's kind of on the verge. So we don't do it just because we don't know enough about it. We don't want to hurt, do any harm, so. All right, so just briefly, treatment approaches. So I've gone through just a myriad of all these different things. How do you do, with your horse, what do you pick first? How do you progress with your treatment options? First thing, foremost, like we talked about, is diagnosing. So we need to make sure that we know that your horse has arthritis. There's no point in doing this if it's not what's going on. So lameness exam, flexion tests, numbing the joint, like we talked about, and radiographs, so x-rays, may or may not tell us. And then if you do think there's a ligament or a tendon tear, then an ultrasound is the best thing to do. So we want to make a good solid diagnosis before we do any of this stuff. Okay, so treatment approaches, the way I usually approach it, it depends on how severe the arthritis is. If it's mild and we're in the beginning stages, I like to put the horse on one of these products, a nutraceutical. So Adequan, Platinum CJ, Cosequin, some people double up on them, Legend, those sort of things. I've had horses that are just mildly lame and respond really well to just this. And that's a lot better than going into a joint and doing all sorts of stuff if we don't have to. I also think horses that are athletes and being used a lot, it's a good idea to have them on this anyway, because all of their joints are going to be traumatized to a certain extent. So that's a good thing to do. Some horses have very mild arthritis, and just when they're used they get a little bit sore, but it's no big deal. And those are ones that we may treat symptomatically with the Surpass cream or Butte or Equiox, just kind of as needed. The ones that have more severe problems, we usually treat with a corticosteroid and hyaluronic acid. And some of them we do IRAP if we think it's needed, or if the owner would like to do that when it's an option. We use the stem cells and polyglycan for unique situations. So meniscal tears, after arthroscopy, stuff like that. All right, how to prevent, and if I can figure this out, I would be wealthy. But there's not a good answer. It's a combination of things. So Adequan, nutraceuticals, proper veterinary care. So if your horse is lame, have them looked at. It's okay to give them a week off or so, but if they're continuing to be lame, we don't want the process to get worse. And then, of course, common sense things, so make sure your horse is fit. You don't take them out on the weekend and run them all day for those 2 days and then throw them up and forget about them for the week, obviously. Things like that, a proper warm-up, cool down, and then hoof care is very important. You can imagine trying to play a sport in high heels or, some shoe that doesn't fit. It's going to throw all of your joints off. So those are kind of basic things for prevention. But there's no panacea. All right, and I'd be happy to do my best to answer any questions if you guys have any. I talked about loss, but yes.
Was there any of the oral supplements that were the protein inhibitors? Or those were like the ones that make the hyaluronic acid?
Oh, you mean ones that were blocking the
proteins?
Oh, for the IRAP one?
Right, is there an oral?
No, unfortunately we don't have anything that can block that interleukin besides the IRAP. So it's just with that joint injection. Yeah, maybe eventually. I'm sure somebody's working on it.
How long would that IRAP treatment go on?
How long would it last?
Yeah.
I think each horse is different and just kind of depends on how bad their disease is. Some can last months or, you know, beyond, but it's not going to fix them forever. Usually they'll come back and need another treatment. Because usually there's an underlying problem, you know, a cartilage damage or something that's going to continue to cause arthritis. So.
Right, just chime in for a minute.
Yeah.
As a whole, with IRAP, I've had the opportunity to see horses over the years that I've had to manage arthritic conditions, and routinely we'll see those horses every 6 months for reevaluation. And there are some in particular where I have injected them with corticosteroids for years and then switched to IRAP and got out to that 6-month recheck and went, wow, you know, they're a little off, but they're not as lame as they had been previously coming off the corticosteroids. So I do think that there's a disease-modifying effect with it, that those horses are actually having a little bit of healing and it's lasting a little longer. I see that repeatedly.
Well, then one of the real beauties of it, normally when we do the IRAP draw, we'll end up with enough of that serum to treat one joint 4, 5, 6 times, and you freeze it, and it's good up to 11 to 12 months. So you might treat it 3 times, 2 weeks apart, whatever, and then you have stuff in the freezer that you can use later on down the road. And one other thing on your diagnostics, you had a question about different things. I mentioned nuclear scintigraphy,
Yeah.
ultrasound, and MRIs.
Yeah.
For these guys too.
Yeah, that's true. So nuclear scintigraphy, we can send, of course we don't do that here, but we can send you to a clinic. Nuclear scintigraphy is just where you get, the horse gets an injection of a radioactive material that's connected to phosphorus, which is one of the components that bone uses to build and regenerate itself. So any place that's having a reaction, which would be like arthritis, then a lot of those phosphorus molecules will go to that area and it will light up on the camera. So they take a picture of the horse with the camera. So that's nice because we do get cases that you cannot figure out with your blocks and are kind of frustrating. Some cases don't block out completely, but you still are suspicious of arthritis, and so those are the ones that's nice for that. And then also MRI is nice when you have localized it to a joint and you want to get a better idea of what it looks like. You do have to have it isolated to a certain region, but then you can see what's going on both with soft tissue and the joint. So it is nice to have those for things that aren't straightforward.
Ultrasound primarily for soft tissue.
Yep.
Things like the subchondral bone cysts that you showed in the slide.
Mm-hmm.
They picked those up on ultrasound. In fact,
Yep.
one of those studies, they picked it up easier, more definitively with ultrasound than they did with radiographs.
Yeah. Yeah, and there's a lot of new stuff coming out with new ultrasound techniques, so we're all learning all of those. Dr. Lamb's in here for hours on end. So, well, yes.
If you're using just Adequan or just Legend, are you kind of doing yourself a disservice? Do they really need to be used, like, you know, together?
I don't think they have to be. I think each horse is a little bit different. I think the Adequan, you know, has more of a long-lasting, it's kind of a maintenance thing, whereas Legend is more that you give it every week for 3 weeks before a show type of thing. It doesn't last as long. But I think, you know, so it's, every horse is different. I mean, I don't think there's a perfect way to do all of them. But Adequan's more just, like I say, it's just maintenance. You give it all the time. That's at least the way I use it. I don't know if you guys use it differently.
HA, given to a Legend, given to them, will stimulate the joint to produce more HA. Adequan will make the joint do that also. It stimulates production. So you're, to some degree, you're getting a little benefit from Adequan, just as if you give them some Legend.
Yeah.
It produces as much as if you give it, but it will have the joint produce HA.
Yeah.
The problem that they've talked about with it is, and we used to, and we still do, is giving these horses a shot of Adequan once a month. I think that we're really helping them out. It really doesn't work that way. It's more of an accumulatory effect where shot 2 gains up with shot 1, 3 gains up with shot 2 and 1, and you need to get X amount into the system. It's good instead of just hitting with the shot once a month. It doesn't last very long or produce a high enough level. Better than nothing, but it's still not as effective as if you had on a loaded series of it.
Yeah. Yeah.
If already doing adequate, would it be helpful to also add something like platinum performance CJ, or is that kind of not?
I think that there's lots of things that it offers that Adequan doesn't have, vitamins, minerals. It's got the HA in it, it's got chondroitin. So how well is your horse managed on the Adequan?
He's fine, he's old.
Yeah, okay.
25, so he's
Yeah,
old.
yeah.
But he's always just a little off, not
Yeah.
off enough to, to stop me from riding him.
Right.
Just a little. So.
Yeah, I'd say, if you're still having a little bit of an issue, it would definitely be a good idea, especially an older guy could deal with some vitamins and minerals. So I think that would be reasonable to do it. And if you're not seeing a huge difference, but it's an overall benefit to the horse, so that's a nice thing about it. So, yeah.
Along that line, would it have been a joint supplement and the shot that was sort of systemic? Is that done together to benefit, secondary benefit?
I'm sorry, I didn't understand. So.
Well, I was thinking of this is a group.
Oh.
A joint injection.
Yeah.
Or some kind of supplement.
Okay.
Can you double up?
Yeah. So would you ever do a combination of treating the joint itself as well as a systemic type?
The horse has a shot every month. He had a shot, like for how many weeks, and then he now has one once a month.
Right.
But could we give him the joint supplement and a shot?
Like
Much for him.
you mean like an oral something he eats, or oh yeah, no, you could do both. You could do both. It just it depends on how well he's managed. Is he comfortable? Is he comfortable with what he's okay? Yeah, I wouldn't say that you absolutely have to do it, especially if he's doing well with what he's already on. If you're still having a little bit of an issue or you want the extra vitamins or minerals, then you can add it in. It wouldn't be wrong to do it. But you don't have to. It's not gonna, make him perfect, but
The
yeah.
problem is that cartilage protectors, and you get some of these older horses with really bad joints, they have a lot of cartilage left to protect.
Yeah.
It's like us, you're going to go get a knee replacement because there's nothing left to deal with. And that's where they don't respond as well as when there's bone on bone. It's quite painful and difficult to treat.
Well, he was a head vocal for years.
Yeah.
Mm-hmm.
And now he's 23.
Yeah, you got that knee.
He does pretty good.
Yeah, good.
I mean, he's always a little.
But yeah, using both of those and helping things out.
Yeah.
I'd recommend if you were given Adequan and oral supplementation, but because there's really not a threshold, probably. There's a threshold somewhere they're only going to utilize so much of it. I think giving Adequan and oral is over the threshold.
Probably helping some.
That's what it should say.
Thank you.
Yeah.
So rather than if you were doing the Adequan on a monthly basis, are you better off going by the instructions with a loading dose and doing the loading dose of 7 injections over a course of 7 weeks, or whatever it is, and then just doing that a couple times a year versus Adequan every month?
Yeah. Well, I mean, could be different between every vet that you talk to. I usually do the loading, and then just as long as you're religious and do it every month, that's just what I stay with. And I don't know if Dr. Lamb does it different.
We were at a big layman seminar with the AD put on AEP, and that was one of the questions that was asked. This was just for veterinarians. Dr. Markel got up and asked the question, and there was 5 panelists that are really well known. Orthopedic people about what do you think benefit we're giving these horses by giving them a shot of Adequan once a month? And all of them agreed it's better than squirting it in their ear. But as far as getting the effect that you really think you're getting, you don't get that much. It's that far down the road. If they were loaded up on it and then doing them, but they recommended probably no less than 2 weeks in between.
When we first started, it was 3 injections. And then
The legend is 3 injections every 10 days. The Adequan program, they recommend is you give them a shot every 4 days, 7 times, which is a month. And we play with that unless you may do different. A lot of times a box of 7, which is how we package it, I'll give them one, instead of 4 days, a lot of times I'll go 7 days. The first 4 shots, and then maybe 2 weeks on the 5th shot, 2 weeks on the 6th, 2 weeks, 3 weeks on the 7th, and spread it out. Unless it's an acute joint injury, then we get right after it, we give them 4 days.
And I think on the other side, on the legend, we have to use our clinical judgment often on how the horse responds. And I can tell you what made me a believer of a monthly or every 6-week legend shot will help them is the horses that I was using on that were geriatric and actually couldn't even get up and down and were running the risk of euthanasia because their quality of life was declining. And putting those horses through a loading dose, just 1 week for 3 weeks, and then putting those horses on. Often in the winter, I'll have to do every 4 weeks. In the summer, I can stretch it out with the warmer weather. But when I got to that point where they needed their shot, I was going out on emergency calls, getting them up in the morning again. And so by giving them that shot once a month, I kept seeing them. They were getting up and down, they were happy. So obviously, that's legend, right? And obviously that has to transfer to our performance horses as well. There's some effect out that 1 month period.
Any more questions? All righty. Well, thank you guys for coming. I hope it was helpful.